Hi, everybody. Thanks for joining today for case studies on PAPs and pelvics. I'm Molly Bechtel, and I'm one of your faculty on the 576 course. So without further ado, we'll get started. This will be in 15-minute increments, case studies due to some limits within the Screencast-O-Matic platform. Go ahead and advance to the next slide. Okay, so the first cases we're going to have are teen well woman visits. If you will, use both the ACOG committee opinion on well woman visits and the American College of Physicians screening pelvic guidelines in adult women as references. This will help guide you through the cases. The first case is of Aurora Rose. I actually had a patient with that name just over the weekend. So I decided to use her name. But our Aurora Rose is a 14-year-old female. She started her menstrual cycle at the age of 13, menarche. Her periods are mostly regular, and her last menstrual period was 2 weeks ago. She does report douching after menses. Her mom told her that was a good thing to do. She has some moderate acne. She's never been sexually active, and she discloses that to you without her mom in the room. And her chief complaint is, my mom made this appointment for me saying I need to come in for a female exam since I've started my periods. What are the recommendations for Aurora Rose? Number one, she does not need a pap smear until she's 21 years of age. Clinical breast exam certainly could be done at this visit, although this, may be uncomfortable at her young age. ACOG reports there are no clear guidelines that exist on when to start clinical breast exam. So if Aurora Rose doesn't have any concerns, this can be deferred. But then again, if this is something she's interested in going ahead with, then it could be a good opportunity to demonstrate the skills of self-breast exam and self-breast awareness. Next, a pelvic exam is not indicated. And that's a movement we're seeing, throughout all of women's health, that where we used to do pelvic exams all the time, and it was kind of wrong not to. The evidence really doesn't speak to it being particularly helpful in an asymptomatic young or older woman. And then lastly, an external genital exam, which is part of a complete pelvic exam, would be optional. This patient definitely doesn't need the internal piece of the pelvic exam, but there's kind of controversy on, the stress of it and fear, embarrassment of getting a pelvic exam that the American College of Physicians mentions in their article. But ACOG outlines some benefits of doing this external genital exam in the younger woman, especially to evaluate for normal external anatomy. And this would be an opportunity to educate this young woman on the variation of normal female anatomy. A lot of times young women have questions. They might be, shy to ask about it. Is this normal? I've got this here. And then addressing issues of personal hygiene is also mentioned by ACOG. Okay, so what else for Aurora Rose? Well, if oral contraceptives are considered for her treatment for her acne, a PAP is still not indicated until age 21. Next, we'll want to advise Aurora Rose to stop douching and discuss vaginal health, that the natural menstrual cycle really is cleans out the vaginal area, and douching can more often than not introduce an unhealthy balance of pH and such in the vaginal area that could lead to infections such as BV and yeast infections. So we'll discourage her from doing that. And most importantly, this visit should focus on education. This is a young woman who's really, her body has changed a lot over the last couple of years. She may, or more likely, may have not had really detailed discussions with her parents, just with the embarrassment factor on her anatomical development and changes that are, very normal to be experiencing. It's a great chance to discuss body image and talking about maintaining a healthy weight. I didn't give you BMI data for Aurora Rose, but we'll assume she had a normal weight. But I remember a past study that reported that, when young women become teenagers, they become less physically active. Well, back in my day, they were talking on the phone more and stuff like that instead of, being more active as the boys were at the same age, doing more sports and stuff. So talking about the importance of exercise and healthy eating, just as to create a lifelong habit of, healthy activities. And then last but not least, addressing immunizations. The HPV, human papillomavirus vaccination, also called Gardasil, should be included in this discussion. Currently, this is not a required vaccine. It probably won't be, just because some parents don't like the idea of vaccinating their kids for STD. Or they don't want to think about their kids being sexually active, even that we know the average age of first intercourse is rather young. I think it might be even 15. So, the ideal thing is to immunize before first sexual activity. But still, it's an optional vaccine. So having a detailed, helpful discussion, answering all questions for both parents and patients is helpful in moving forward with vaccination. Okay, next let's move on to Zelda. She is a 17-year-old young female patient. She is sexually active. She had her menarche at 11 years of age, and she has monthly regular menses. She's had 2 sexual partners so far in her lifetime. She does use condoms most of the time. She's asymptomatic. She doesn't have any female complaints at all. And she's just coming in with a chief complaint saying it's time for her to have a female exam and a pap smear. That's what her mom told her. Yes, there are several recommendations for Zelda. Number 1, we'll educate Zelda that she does not need a pap smear till she's 21. Even though she is sexually active, she does not need a pap smear. And it's going to take probably another 10 years before the word is out on this to all parents, because a lot of parents, when they grew up, you would be getting your pap smear earlier, especially if you're sexually active. So that has changed. For her female exam, the clinical breast exam could be done, or it could be deferred, as we discussed with our previous case. ACOG mentions in their article position statement that breast cancer is very rare before 20 years of age. So it's probably not necessary, but again, it may be a great learning opportunity. I think it depends on the young woman, and I think it's something we could offer, saying, would you like to have your breast exam this year? Would you rather wait till you're older to do that, and give them the option? If I do complete your clinical breast exam, then I can show you what I'm looking for as I'm doing it, and how to get to know your breasts and what they feel like normally. Or we can wait and do this, around 21 with the first pap smear. And then The other piece would be the external genital exam, and this could be completed or deferred. So yes, we have some well-woman recommendations for Zelda. The self-breast awareness education can be done with or without performing the clinical breast exam. With Zelda being, sexually active, family planning options should be discussed with her. Certainly discussion on the failure rate with condoms only, which is probably about 20% rate of pregnancy per year using condoms. And does she know how to properly use a condom that needs to be taken off right away? And so all those techniques are important. Also, it would be appropriate to inquire about sexual experience satisfaction and screen for intimate partner violence. This is a USPSTF grade B recommendation for women of childbearing age, and she is of childbearing age at 17. A discussion of STI prevention and risk reduction. Again, discussing the HPV vaccine and answering any questions and starting the series if she has not started it. We usually start it around 12, so she's a little late getting it, but you'll run across lots of people that haven't gotten it yet because, again, it's not required. And then for Zelda, it would be appropriate to do a urine screen for gonorrhea and chlamydia, since she really doesn't have to have, the pelvic exam piece to collect a gonorrhea and chlamydia screen like we did back in the old days when there wasn't the urine testing. We now have this option to check non-invasively for gonorrhea and chlamydia. And this is a grade B recommendation as well with USPSTF to screen young women under the age of 24 and younger rather, for both gonorrhea and chlamydia